Hello guys, how are you doing? As we have 128 days left for the exam, I'm saying it 128 because it's always good to have a buffer day. So this is my plan for you. As we are having 128 days go to the exam, so if you even do 14 days for the last minute revision, so we have 114 days. As pattern is changing, AIMS questions are also must crack this NEET 25 exam. As you know, NEET 24 pattern has changed entirely, and you have even seen we have even seen some questions from AIMS pattern also. So what my plan over here is, so I don't want to post some random questions because your time is valuable. So from Feb 5th, from yesterday onwards only, I have started posting INICET November 24 questions. So the entire month of February and March, that is it will come up to 55 days. Let's solve last 5 year questions of INICET, that is 2024 to 2020. That is a 5 years, and each year we have 2 papers, so we have at least 5 questions per day, that is 5 days per each paper. We can solve 10 papers, that will take 50 days. So in 50 days we can complete at least the top 25 questions from each paper, which have been repeated, which have a potential to come in the NEET exam also, because AIMS questions are very good and they have a high potential to be asked in the NEET 25 exam. One must also prepare AIMS INICET pattern MCQs to get a grip over the subject. So, and in the February and March, the plan is this. Let's proceed from INICET November 24, INICET May 24, and the way backward. So 5 questions per day, 5 days each paper. Let's solve in that way. And in April and May, let's plan NEET PG, PYQS and much more. How do you think is the plan? So following that pattern, today's first question, today we'll study 5 surgery questions from INICET, because surgery has a major weightage even in NEET. So the question over here is, a middle-aged woman presents with flank pain and painful micturition. The pain was relieved by IV analgesics given at the PHC. The patient is diagnosed with ureteric colic due to ureteric calculi. What is the best modality in this case? What do you think is the right answer for this question? NCCT KUB, UST KUB, CACT, uteroscopy. As you guys can see, even if you have a basic knowledge while working here in your internship days, it's very basic that even in the case of kidney stone or ureteric calculi, we order NCCT KUB as it's the best modality, because CACT KUB, we don't do CACT because contrast enhanced CT is nothing but knowing the calculi. So calcification, we can find that in the NCCT only, no need of CACT. I posted this question because after saying while giving my AIMS exam, after seeing this question, I was confident that they gave such an easy question, and you don't believe me, but I ended up marking the answer of CACT just in a hurry, because I was very confident about this answer. I thought I marked NCCT, but I marked CACT. The lesson I want you to learn here is, when we see a question which we know, we get excited and we don't want to waste time as the time is running. So we quickly mark the answer and go to the next question. So while answering a question which you know, take a minute of time to check whether you marked the answer correctly or not. This is the lesson I want you to learn from me. Don't get excited by seeing simple questions. Take a minute and answer it correctly and check whether you answered it correctly or not. Coming to the second question, a 25-year-old male with a history of road traffic accident is brought to the emergency department. His GCS is 8 out of 15, oxygen saturation is 85%, BP is 100/60, heart rate is 60 BPM. On auscultation, his right side breath sounds were absent. What is the next step? Best step in the management. The options: secure airway, give oxygen, insert ICD, secure IV line. Option B, administer IV dextrose followed by NCCT head. Option C, start IV fluids, give atropine and secure airway. Option D, evaluate for head injury and do CT head. What do you think is the answer? I want everyone who is watching this video to comment this answer below, because it's such an important topic that this topic is repeated in every exam, be it INICET, be it NEET, PG, be it UPSC exam, UPSC CMS exams, any exam. This concept is very important because these are the life-threatening conditions which we need to act immediately. So from this question, every point in this question is important. You need to know the differential diagnosis of such questions also. I want you to answer this question. Coming to the third question, which of the following is not a derivative of neural crest cells? The options are ciliary muscles, retinal pigment epithelium, ciliary ganglion, melanocytes. What do you think is the right answer to this question? These kind of questions are very simple as they are factual based, and are also tricky because if you know the answer, you know it, or else you don't know this. Neural crest cells, this topic used to be very difficult for me. Like, I used to study all the derivatives, I used to memorize all the derivatives also, but whenever a question comes with all these options, I used to get confused. The same thing happened with me in the exam also. I was very sure that something is different with the ciliary muscles. Why would muscles be derived from the neural crest cells? I thought that, and I marked this as the answer. But the thing is, ciliary muscles are derived from the neural crest cells. While we read the eye embryology, this point is specifically mentioned over there, but I messed it up. So be very sure of these concepts, and such concepts go in the 20th notebook. 20th notebook need not be any fancy notebook it can be a simple notebook. At that time, this book was available at my home, so I just picked it up and I noted this. Whichever is difficult for me, I used to note that in this book. So 20th notebook helps you in remembering things which are difficult. Don't think that I don't have a 20th notebook till now. Will it be can I start it from now? Please start it from now. 20th notebook or choti copy, whatever name you give to that, it's a wonderful tool to just memorize things. You know this that these things will be forgotten, so you just need a small book to note that. That's it. So here the answer, here the ciliary ganglion, all the ganglions are from neural crest cells, melanocytes are from neural crest cells, specifically ciliary muscles are from neural crest cells, except retinal pigment epithelium, which is a derivative of neuroectoderm. So please revise the concept of derivatives of neural crest cells, derivatives of neuroectoderm, all the derivatives, they are very important. Fourth question. A 34-year-old female presents with a lump in her left breast for 2 years. On examination, a 6 × 4 cm mass is palpated. Dimpling of the skin and bloody discharge from the nipple is present. This lesion is invading the pectoralis major muscle. Ipsilateral level 1 and level 2 matted axillary lymph nodes. There are no distant metastases. What is the TNM staging? What do you think is the right answer to this question? The options are T4N1M0, T3N2M0, T4A N1M0, T2N1M1. Again, this question is easy if you know this. This question also goes into the 20th notebook because how many times you read the TNM staging, it's difficult. There are many TNM stagings. If you don't read all of them also, that won't be a problem. But if you miss breast TNM staging, that's a big mistake. So let's revise TNM staging quickly now. So TNM staging, I don't want to just read this fast because this is very important. I want you to take a piece of paper or your sticky notes or anything to write this now along with me. Take a break here, pause the video and write this, because this has high chances to come in the exam, because it's already been asked in the INICET 24. It can easily be asked in the NEET 24 or NEET 25 exam also. So here we have the TNM staging, T staging. T1, TIS is nothing but the ductal carcinoma in situ. Next year you can just give Paget's disease and ask under which T staging can it come. So you can answer that then. T1 is less than 2 centimeters, T2 is 2 to 5 centimeters, T3 is more than 5 centimeters, T4 we have T4A, T4B, T4C, T4D, T4A involving the chest wall, that is involving the ribs, intercostal muscles, serratus anterior, specifically not involving the pectoralis major. If the question involves the pectoralis major, here as it is given, it is invading the pectoralis major muscle. We feel that it's something regarding the staging, but pectoralis major muscle invasion doesn't come under this at all. So T4B, satellite nodules, ulcer, and body orange, which is a limited body orange. Fixity, tethering, dimpling, puckering doesn't come under this T4B. T4C is both A plus B. T4D is inflammatory breast cancer. This question has already been asked in NEET, some NEET PYQ. Purity orange, more than 2/3 of the breast. So T4, take baby steps. One day learn this one, next day learn this, next N staging. N1, mobile axillary lymph nodes. N1, first everyone will be mobile. N2A, everyone will be fixed. Now we need to do something. Fixed axillary nodes. N2B, we are going inside now. Internal mammary nodes, and then below N3A, infraclavicular nodes. N3B is both axillary nodes and inframammary nodes. Sorry, internal mammary nodes. N3A is supraclavicular nodes. M staging is M. That is a metastasis. Simply reading this can be very easy, but you will forget this, I'm sure of it. So write this somewhere. I'll make you revise this tomorrow also. Let's revise this. Let's not forget this if this comes in the exam. So here he said that it's not invading the, it's invading the pectoralis major muscle, but it's of no use to us. Ipsilateral level 1 and level 2 matted axillary lymph nodes, that is fixed axillary lymph nodes. So we know that it's N2A. So we are having only N2 with a single option. So this becomes the answer. T3, because the size is 6 into 4 centimeters. T3 is nothing but more than 5 centimeters. So this concept also you must revise, and this goes to the 20th copy if you're not remembering this well. Fifth question, a 40-year-old patient who is known case of Hodgkin's lymphoma with a previous history of irritation presents with a right-sided thyroid swelling. FNAC reveals papillary carcinoma of thyroid. There is no lymph node involvement. What is the next step in the management? So papillary carcinoma of thyroid. I know that I thought that papillary carcinoma of thyroid is very important. This question will definitely come in the exam. I need to read everything about this, and I read everything about that also. But the fact is they asked the management and with a slight twist. So I was a bit confused. I read everything about papillary carcinoma of thyroid, but he gave some other question. So the options here are total thyroidectomy with modified radical neck dissection, hemithyroidectomy, and hemithyroidectomy with modified radical neck dissection. What do you think is the right answer to this question? This image is from the PYQs of Marrow. So sir here is saying that hemithyroidectomy is an acceptable alternative to total thyroidectomy in low risk unilateral differentiated thyroid carcinomas like papillary thyroid carcinoma and follicular thyroid carcinoma between 1 to 4 centimeters without extrathyroidal extension. And there are few exceptions to it. Remember this now. Here radiation induced differentiated thyroid carcinoma, familial non-medullary thyroid cancer, multifocal bilateral DTC, extrathyroidal extension. So whenever these 4 things are there, we need to do the total thyroidectomy. So the same has been asked in this question also. Here there is a history of irradiation. So we need to do the total thyroidectomy, and as there is no lymph node involvement, the modified radical neck dissection is not needed over here. And when do we do the modified radical neck dissection? The patients, we do the total thyroidectomy. If level 6 lymph nodes are involved, we do the total thyroidectomy plus central neck dissection. If T3, T4 disease, prophylactic central neck dissection. And if other nodes, TT, CND, and modified radical neck dissection. So whenever you read a topic, read it fully also and revise it fully also, or else the first time you are reading, remember it fully, because we don't know what he asks in the exam, and we have a live PYQ here, so it can be asked in the next exam also. So the main point of me telling you this PYQs is, even though if you're not reading, I'm not reading surgery today, how will this video help me? You may think like that, but while reading surgery, you might remember my words saying that I did a mistake here, I thought this is like that. While telling the neural crystals, I was confused between these two options. You can learn from me, or you can at least remember my voice that yeah, this question has been asked and somebody did a mistake. While reading, I should not make a mistake, and I should read this topic thoroughly, because this is also a PYQ. So that's my main motto. Even if you're not studying surgery today, while you study surgery, when you study surgery, you will remember me saying that this topic is important, don't mess it up. So I want to be that study partner for you. So that's it for today. So how do you like the plan? Tomorrow also we'll continue with the top 5 questions of INICET November 24. If you're liking the channel, please like this, share this to your friends, and comment below how is the plan, and also the answer to the second question. See you tomorrow.